Yes, thank you. Thank you so much. Welcome everyone to our YouTube podcast. We welcome you to today's presentation. My name is Sandra Maslan, your palliative care trainer, your palliative care provider. Thank you so much for being part of us today. We are so glad. So today we are presenting a very short, brief presentation. We are going to look at understanding and identifying burnout and compassionate fatigue. So this presentation is all focusing on palliative care providers. So we will have a series of presentations on palliative care providers, especially clinicians and the support staff. We understand that this is a very critical service in the spectrum of healthcare. So we'll be equipping each and every one of us today to see how best we can take care of ourselves in ensuring we provide best care for other people. So we are going to look at, we are going to focus on these two, compassionate care and burnout. Okay, let's go. I want us to go. Yep. So for the first time, I want us to understand one thing. Why do we have this podcast today? Why do we have to focus on burnout and palliative care? When has it become so important to us that we look at this aspect of our health as service providers? Actually, if you take this concept of burnout and compassionate fatigue away from palliative care, it's more common in the service industry, more especially in healthcare, whereby we are working, we are pulled through, we face a lot of challenges. Sometimes there are client-based problems, there are professional or provider-related problems, sometimes there are systematic problems. So we are faced with more challenges and more demand on the output. For every employee to be productive, this is one of the things we need to take care of. Remember that we are employed for a certain process or a certain period, and then after that period, we are out of the system. But then the question is, how do we remain productive in our prime time that we may contribute to the advancements of the economy and the development of our lives and the development of our clients or customers better? This is so much important even for other businesses or organization institutions outside palliative care service providers. So if you are interested to know how can you make your life better as a palliative care provider, work with me in this. So the question then is why this matters in palliative care. By the way, palliative care, we know it's this care that we provide to people with severe illnesses. So, and we are dealing with people with life-limiting and threatening conditions. They are at different phases of their life. Some are at diagnosis, some are undergoing their treatment, and some are approaching their end-of-life phases. Some are bereaved. So we are dealing with different kinds of people. And the most thing is that this service requires one who is compassionate, and it requires one with the humility and ethical, so that you can provide services to these vulnerable populations to the best. And the major goal that we are targeting in palliative care is to improve the quality of life. So for that reason, we are going to focus on burnout and compassionate, because as we strive to return, to give people dignity and improve the quality of their life, we need to also focus on the quality of life. You cannot pour from an empty cup. So that's the reality we are going to look at in this time. So we are going to take very few minutes and then we are out. So in palliative care, as I've mentioned that this is a specialty that requires or demands unique emotional investment from the clinicians or the service providers. So it requires an emotional demand on them. Every day they need to have a surplus of it, or they have to have a full package, or they must have enough to pour out emotionally. It demands on their emotional intelligence. It requires that you have strong emotional intelligence. It requires that you have physical intelligence, you have mental intelligence, and it requires a strong spiritual intelligence. It's a very demanding aspect of care. So from these professionals, they face a very unique emotional demand compared to other people. So these ones in palliative care, they are faced with unique emotional demands. And this is because on their daily practice, they are exposed to people with different levels of suffering, from physiological, psychological, emotional, spiritual suffering. So they are going through a lot. You find that they are seeing these families, they are seeing these caregivers, they are seeing these patients. They are suffering from a lot of suffering. And they undergo grief themselves. These providers, they undergo grief and they face people with different levels of grief. They face people with a lot of losses. In this spectrum, in this aspect of care, on this discipline, loss is a daily experience. You experience high levels and varying levels of loss. And this results to what we call accumulative stress on the professional, which then this accumulative stress, everybody needs a certain amount of stress, but the consistent exposure of these professionals to this suffering of these clients, this grief and loss, it then builds up this stress that accumulates up and again and again and again. And as this level of stress accumulates as their daily routine work, they then develop what we call the erosion of well-being and the erosion of productivity and effectiveness. And then it erodes the drive, it erodes the person, it erodes the human being who needs to be compassionate. So it takes away our well-being. We lose a part of us as we give out the love. It's more than the drugs, it's more than the teaching, it's more than the training, it's more than the education that you give these caregivers and patients. It's more than the care that we provide, the interventions that we come in within and work with the families. It erodes our well-being. And then we tend to, after a long time, lose our effectiveness. You find that the first days or months or years into service are not the same as the years after service. So if you will plot that one, you'll discover that the effectiveness went up, but then at times it goes down. So there's a lot that happens with these workers. So then recognizing burnout and compassionate fatigue helps us as professionals to protect ourselves, to protect the caregivers, to protect the patients we are taking care of, because The moment we accumulate burnout and accumulate this compassionate fatigue, we become toxic to ourselves, to our colleagues, and to the patients and their caregivers, let alone the families. So instead of us helping, we become then toxic because of these two elements of compassionate fatigue and burnout. So then what does it mean? It requires us to be able to identify this as soon as we can and be able to get help as possible as we can and be able to deal with it as well as we can. In palliative care, we said that accumulative pain is hard to deal with, so we need to attempt and deal with this pain as early as possible as we can. So prevention is better than cure. So this is what we are going to try today to say, what can you identify to say these are the signs and then what can you do? Okay. So these are two distinct features, this burnout and then compassionate fatigue. They may look alike, but they are not. Looking at chronic fatigue, it deals with this emotional exhaustion, the dispersonalization, and the reduced sense of accomplishment. Once you begin to experience these are classical aspects of burnout. And this one, it doesn't have, develops once and beyond, at full blast. It develops over time, and it takes time. You begin to get this emotional exhaustion. You begin to dispersonalize. You begin to lose the sense of accomplishment. There's nothing that motivates you now. Even if you do great achievements, it doesn't motivate you anymore. So that's one it's a result of what we call burnout. But then compassionate fatigue also has this profound and physical exhaustion now. It comes with this emotional and physical exhaustion. Burnout, emotional exhaustion. Fatigue, it comes with the physical exhaustion. And then this one, most of the time, it's a result of us absorbing, inheriting the trauma from other people. They are suffering, bearing it in our lives. So then we develop this compassionate and emotional fatigue. So it's like the cost we pay for taking care of other people. So it affects us as we become more empathetic and engaging these people, trying to understand what they're going through and putting ourselves in their shoes, understanding what they're going, trying to help. We are paying through compassionate fatigue. So it's like when you have money, you need more of compassionate compassion threshold in your pocket so you can survive this. So how much do I have to pay? So the more we care for them, sometimes the more we get this fatigue and then we pay more. So if you are not replenishing ourselves, the reserves, we get more drained and our pockets dries up, and then sometimes we end up having burnout. So these two, they coexist. So I've mentioned that the practical signs of burnout is that emotional exhaustion, the dispersonalization, and reduced feeling of accomplishment. There is reduced feeling of accomplishment, and sometimes it comes with chronic fatigue and sleep disturbances. Sometimes you can't sleep, increased irritability and mood swings. You are quickly irritable. Have you seen this colleague that a small joke, it's a serious issue to them now? You know, a little bit of a sound or noise irritating. When they see people laughing, they quickly say it's about them. So there are mood swings. Immediately they are laughing, and now they are sad. They are like a tornado. You can't predict what they're having. And then later, some of them, they develop these withdrawal feelings. You find that they withdraw from group activities. If it's a teamwork, they begin to look for solitary work. They want to do it alone. They don't want to participate with other people. Sometimes they have this difficulty in concentration. In a small minute of time, they are asleep. They can't concentrate in anything. Very soon, they are out of anything. So you give them a task that can't concentrate. You expose them to work, they can't focus. And they tend to have a lot of mistakes. They're supposed to administer an injection, but they use different, sometimes administer the wrong drugs. They can't concentrate on what they're doing. And sometimes this accumulation of burnout will lead to absenteeism. This employee will begin to look for opportunities. When can I be absent from work? The unfortunate part is that if they are absent from work, the reason are not that much substantial. When they are at home, they can't even cope at home. They want to go back to work. So they don't want to be anywhere. And sometimes, if not managed, they may commit suicide. Sometimes they will even resign from work. They will have the intentions to say, I'm resigning today. So another thing that we need to understand then now is to then, how can I recognize that now I'm having emotional fatigue? So one of the things we will know is that you can categorize the behaviors or presentations into three. You may have emotional symptoms, you'll have the physical manifestations, and then there will be behavioral changes. So once you have this numbness, this detachment, so it's similar close to burnout. Emotional symptoms, they are almost the same. You have this reduced empathy capacity. You know, these people who become insensitive, they cannot handle anything. They are rude. Have you met clinicians? They feel rude. They are insensitive. They don't mind. They talk harshly. They are no longer treating person with dignity. They don't care. It's not because they were like this from initially. Some of them, they were good, but compassionate fatigue has destroyed them. So they have these insensitive thoughts. So that's how normally they become. And then another thing you may notice that you experience a lot of physiological problems. Have you had these clients or these professionals? Now and again, they're in the wellness office for headache, gastrointestinal problems, diarrhea, stomach ache. They have a lot of problems, gastrovascular problems. They developed a lot of problems. And these professionals, they are vulnerable to NCDs in the long run. So in the long term, they are vulnerable because they are exposed to this consistent trauma, and that leads to serious health problems. And another one is the behavioral change that they also experience. They avoid patient interactions. They are poor communicators. They don't want to have conversations with the patient. So they run away from what the patients want to talk. When patients want to engage them in conversation, they don't have to take time with the patients. They are in a hit and run experience. So once we have these patients in palliative care, you would know they might be experiencing fatigue. They are overworking and overcommitting. They don't have a limit. You say there's this task, they want to take it. They have no stop. Everything they want to do, they are committed a lot to task, and sometimes they finish none of them. So they overwork them. They don't sleep. They want to work all night, trying to get some fulfillment out of it. And one of the things that you will notice about these professionals, you tend to begin to use, to misuse substances. Even if this person was drinking alcohol once a month, now he was drinking every day. Every week he's drinking. It's like a Friday, it's a party day. He doesn't have time to rest and come to reality. He wants to escape the problems. He wants to escape the fatigue. So they drink a lot and they increase their drug substance use. They tend to abuse this drug. In fact, this is a health professional, but the way he's using these drugs, there's high misuse. He can't control. What does that lead to? It leads to financial problems and social problems, even at home. They tend to become social isolated. And then who is most vulnerable in our work? So these following people are vulnerable. Perfectionist tendencies. You know, when you are a perfectionist, you set unrealistic high expectations and standards for yourself. And this tends to make you struggle to understand patient limitations. You are a perfectionist and you are prone to burnout and compassionate fatigue. Two, poor boundaries. There are people who have poor boundaries. You know, there's what we call work balance in human resource management. Balancing your personal life and work life. This is very important. And people who have porous boundaries between work and themselves, they are high risk of compassionate burnout, compassionate fatigue and burnout. Because they have this difficult. They can't separate it. They take patients' issues home. They take patient issues to socializing spaces where they are supposed to rest and focus on themselves and their families. They tend to discuss patient issues. That's why giving clients even their personal numbers to call them when they are home. Remember, these patients are sick. They need somebody. And you are a good candidate to support them because you have compassion. And that's a good skill and a characteristic that we need in service. That as an employee, you have compassion towards your customers and clients. But then when it's extreme, you don't have boundaries. You can't shut down when you're out of work. Even when you're out of work, you can't rest. Over the time, you're stretching yourself. Then you have burnout, and then you have emotional and mental problems at the end of the day. And then there's what we call personal trauma history. You know, we are also human beings. Understanding that, that's very important. Understanding your own history and traumas, that one is very important. Even you're enrolled to healthcare, understand your traumas and be able to manage them well. Because if you have unresolved losses and grief and traumas, these will resonate with the patient experiences and it will come back and fresh again. So we need to take care of ourselves and be in a position to manage that one. So if you are poor managing your personal traumas, you are prone to quick to burnout and compassionate fatigue. Inadequate support, you know, we know and understand managers, they know that we need to give both resources and support to employees. When there's limited support to employees, when they are going through resource limitation, they are going through neglect from the managers, they tend to develop burnout and compassionate fatigue. So we need good support supervision. They need to have access to debriefing sessions. You can't go a full year in healthcare without debriefing. Those wellness units, they are not just for minor elements. They are there to facilitate the issues of debriefing. You need to debrief one way or other. We need to debrief, but lack of debriefing will lead to compassionate fatigue and burnout. Then you will have the problems whereby healthcare workers, they will mistreat other people. They will become rude. They will be drug addicts. Why? They've been exposed to lack of support. So even the issues of high caseload complexities, there must be, the ratio must balance between the employee and the workload. You know, managers need to understand that, yes, we know there are limited resources, but for us to have good productivity and good quality care, these two must balance. The employee and the patient ratio must be reasonable. You find that a person is taking care of 1,000 people. You go to the hospital, a long queue. He can't even go to lunch. He's stretching himself over. They will quickly die. And in fact, that even when retirement comes, they exit the work environment with complications. They will not enjoy what they've gone through. So this must be managed very well. You can't go a long way with this. So that's what becomes the role of the managers, to ensure there's always a balance, so that as we are looking for efficiency and maximizing the output, but we have to have the limit. And that need to be tracked and managed, because remember, HR, that are the limited resource that we have, and they give us a competitive advantage and productivity of these companies that we have. So excluding and not balancing the ratio of the work and employee, you will find that. So there must be work or job employee balance. Okay. And then this is how you can assess your current state. It's very important to do daily reflections of your life. Every day you go to work, you do some reflections. How was my work today? Or before even you exit your work today, do some reflections. What went well? What didn't work well? Have you been emotional? Have you avoided certain patients? You have found that when you are experiencing compassionate fatigue, patients, you will even run away from patients. When you're in an OPD setup, when they say there's a patient, you run away. If you're in a hospital, in the emergency unit calls and saying we have an admission for you, you feel like you could run away. Those are signs. Things are not doing well. You also ask yourself, did you feel less compassionate are you feeling less compassionate now than when you started? If there's been a change, look for help. Yeah? Are you relying on unhealthy coping mechanism? Your adaptive behaviors? Are you having maladaptive behaviors? Are you taking more alcohol? Are you taking more drugs? Are you doing bad things instead of doing the right thing? Are you going to isolation as a coping mechanism? What mechanisms do you use to cope? So those are the things that are very important to note. All right. So these are the classical signs that you can observe even from other people. Observe behavioral change, listen for language cues. People begin to express themselves in another way. Yeah, there's increased cynicism, hopelessness, expression of feeling of overwhelmed. Listen to if people are shouting sometimes in a lower voice in their corners. I'm feeling overwhelmed. I'm feeling overwhelmed. They are signaling, I'm dying, I'm dying, I'm dying. So that we need to help. We need to help. Monitor team dynamics. When we are monitoring, we watch other team members that are beginning to withdraw from us. So we are each brother's keeper. Watch those who are withdrawing, follow them through, resolve conflict. Let's not go for conflict escalations. When there are conflict escalations, a small issue in the team becomes fire. There's conflict. People getting down, communication breakdown, people cannot communicate anymore. Those are problems that are happening within the teams. And those are signs that the teams need some rejuvenation and we need to start again. And then you need to ensure whenever you're attending to your colleague, you need to check with compassion. So some are also receiving that burnout has very significant effects. It has a ripple effect when it is not addressed. So it affects the patient care quality, team cohesion, personal relationships, and long-term career sustainability. So it has this ripple effect. So we need to identify it as quickly as possible. If there's an HR department, there need to be these employee barometers. So we check it if our employees are still okay, any burnout in them. And we need to encourage, the employees to report. So you need to report and have these conversations, this debriefing session with the employees so they can share, to talk. So when we are employees given the opportunity to debrief, we need to take it serious. It's for our own benefit. It's for us because it has this ripple effect on us. So it reduces the patient safety, clinical errors. Once you are monitoring the operations and you discover that the service delivery, when it comes to the operations, how we are doing the work, there's a lot of clinical errors. We have a lot of errors in what we are doing. Those could be a sign that even though the SOPs are there, the standards are there to be followed, but once there are a lot of clinical errors in the process, that could be one indicator that, you know what, there's a lot of burnout here. We need some rejuvenation from other people, and people must be allocated enough leave to go rest. And when we are given that leave as an employee, use effectively to rest, actually rest, and be detached from work, you know. And the painful part of this is when you are having higher staff turnovers. These, as leaders or managers, we need to understand that when you are having dissatisfaction levels that are so high, and that results to high turnover, that's a sign that there is some mismanagement of the human managers. We are not leading well, so we need to manage even these burnout issues. They might be leading to that. So personal health issues, once the people begin to burn out more medical aid, hospital visits, those are signs they are not doing well. And it has the tendency to erode even team dynamic, morale. The team begins to demotivate people. They begin to devour one another and share their disappointments to one another, dissatisfaction, and these organizational behaviors, they go to fade away. People cannot go an extra mile, and then the performance. Finally, the institution will perform badly, and it will lose stakeholder interest and investment, and other things will be lost. So we need to acknowledge and take action as quick as possible. So as individuals, we need to not be ashamed, take and acknowledge that we are in need. One of the problems we have at Cape, we don't want to acknowledge our needs and look for help. Please, when you are experiencing this problem, shout for help as soon as you can. You need help. Reach out and seek support, and then implement the strategies. I think that's what we can share and say as we go out and continue to support the people we are supporting. Let's be vigilant. Let's take care of ourselves. Let's take care of ourselves. We cannot pour from an empty cup. So letting these burnout and compassionate to lead to the disaster, it will be bad management of ourselves. So self-care is not being selfish. No. If you take care of yourself, you are not selfish. But actually, you are doing good for your own health and long-term sustainability. So let's have sustainable practices of self-care. And let's engage on adaptive behaviors, not maladaptive, to coping with the work environment. We are living in a world where there are stretched resources without enough resources to help us accomplish the task and responsibility we have in the workplace. From top to bottom of the structures of organization, there is the scramble for the limited resources. But that mustn't be the ticket for us to erode the internal, intrinsic resource that we have, the compassion, the love that we have for our customers. That's such a way that we even allow burnout and compassion to spoil our lives. Remember, we are at work for a period, and then we'll exit. Let's enter to the business or the market stronger and exit the market stronger. Don't enter and exit with illnesses and disheartened lives. Thank you so much. We will meet next time again, where we will look at another topic on how best we can take care of ourselves. I think This will be very helpful to you as you think on how best you can support one another, how best you can look for yourself as we go through the work. Thank you and bye.